one of the issues that we're looking at now are the genetics of the epilepsies, and to see whether this is a more important factor than just a few patients with clear genetic abnormalities. And that's looking interesting, it's looking promising, but it's expensive, and it's not going to be available to everybody, every neurologist in the world treating people with epilepsy. It will be available to us as super specialists. And hopefully it will give us insights into improving the pharmacological treatment of seizures. So that's going along quite well. Magic markers, magic drugs, we're not seeing them. When I started, one of the reasons that I got involved in epilepsy is that people were doing trials with lots of drugs, and we were having a new drug every two years or so. But all these new drugs haven't really changed the outcome at the end of the day, which is disappointing. I mean, I've had a good life and I've enjoyed it and I'm not complaining, but it would be nice to get people cured of epilepsy, and the medications we have, as I said, don't really do that. We're looking now to see if we can identify better medications. Surgery is useful for many patients. It's not available for that many patients, but still there's options of perhaps having more people access to good surgical treatments. But it's expensive, and if you're looking globally, you know that we always say that something like 70-80% of people in the world don't get treatment for their epilepsy at all. It's a problem that we can't easily solve. It's not about the medicines. It's about the surgical. It's about the availability of clinical care in a world where there are a lot of poor people in a lot of poor countries.